550,000. Thank you.
We're down a minute to get down, anybody else ground, and to get all through, well done. $1,050,000, $1,050,000 and a half. $1 million, Blake, thank you.
Juddmonte.
Established in 1982, Rood and Riddle Equine Hospital is a worldwide leader in equine healthcare, providing a full menu of specialties of services and treatment for all breeds and disciplines of horses, from the family companion to the high-performance athlete. Learn more today about Rood and Riddle Equine Hospital. Visit roodandriddle.com or call 888-773-4838.
Okay, I'd like to welcome everyone to the 2025 Virtual Thoroughbred Owner Conference Series, and I'm Gary Falter with the Jockey Club. Now, this is the 9th webinar in our series of 10 panels that will take place this year. So this is number 9, and you'll find our full schedule, the past panels we've done this year, and the one that's still to come in December on our website, ownerview.com, and we have the date and time of the last remaining panel this next month. So today's topic, we're going to talk about foal conformation and corrections. And as a discussion progresses, welcome to use the Q&A feature to submit any questions that you have about today's topic. And at the end, we're going to get to as many questions as time allows. So before we get started, I'd like to take a moment to recognize our sponsors, starting with our presenting sponsors, which are Bessemer Trust, Keeneland, and Stoll Keenan Ogden. I believe you saw Stoll Keenan Ogden's ad a moment ago. And our panel sponsors today are Juddmonte Farm and Rood and Riddle Equine Hospital, and you should have seen their ads a moment ago. And our Q&A sponsor is West Point Thoroughbreds. And our sincere thank you to all the sponsors for their continued support of thoroughbred ownership and this webinar series. And you can see on the screen all the sponsors for this year, and we're just truly very grateful and appreciative sponsors. So today we're fortunate to have one of the surgeons from Rood and Riddle Hospital to help all of us understand some of the issues with foal conformation and corrective measures. So with that said, I'd like to introduce our speaker today. So we have Dr. Allie Broyles. Welcome, Dr. Broyles.
Hi, Gary. Thanks for having me.
Great. Okay. So just to give everybody some background on Dr. Broyles, so she obtained her undergrad degree at Middle Tennessee State, and then her Doctor of Veterinary Medicine degree at Texas A&M University back in 2010. And she completed an internship at Rood and Riddle Hospital in 2011, and then she worked with her husband at their practice in Texas. Dr. Broyles returned to Rood and Riddle Hospital for a surgical residency in 2014, and she also worked at the Rood and Riddle Hospital in Saratoga, New York. She joined Equine Sports Medicine and Surgery back in 2018, where she worked until she returned to Rood and Riddle Hospital in June of 2024. Dr. Broyles, let's get started. I've got a few questions for you before we get into the video that we have.
Okay.
So when a foal is born after being carried for about 11 months, is that right? Yeah, about 11 months, 340 days. How soon after foaling is it possible for you as a veterinarian or for the farm manager to assess the foal's conformation? Is it like the next day, same day? Do you usually give them a week? So how long before you really get a good assessment on the conformation for a foal?
Well, there's a few different things that you're kind of looking at depending on the age of the foal. So I would say in the neonate, meaning the first couple weeks of life, and you're looking more for flexural deformities, meaning are they contracted or do they have some laxity? And those issues you might want to address very early on, meaning in the first few days. If they are contracted, then that problem needs to be addressed fairly quickly. And so for example, if a foal is born here at the hospital, we'll assess it right away. Does it have some contracture that needs to be addressed while it's in the hospital? And at the farms, they will assess that as well. For contracted foals, typically we treat them with either splinting or Oxytet or some exercise restriction. For foals that are very lax, meaning they're kind of low in their pasterns, a lot of times those will correct as the foal gets stronger. So you might, depending on the severity, you might kind of monitor those things over the few days and limit their exercise. But typically that improves on its own.
Okay. So when you say contracted, you're talking about a pastern that's really vertical, that doesn't have much angular to them. It's just almost straight up and down.
Correct. Or even, so typically the most common place they have contracture are the coffin joint, the fetlock joint, or the carpus or the knee. And sometimes those foals will either walk on their toes or they have a hard time standing. And those are the ones that need to be addressed with bandaging or splinting. So that versus laxity where they're hyperextended in their fetlocks or knees.
And then a foal that's way down on its pastern, typically they'll strengthen themselves on those.
Yes, a lot of times most of the time they will straighten on their own. If they're very severe, sometimes we'll put heel extensions to kind of support the back of the fetlock. And in those cases, a lot of times people want to bandage those legs because maybe the back of the fetlock is hitting the ground, but actually bandaging makes the laxity worse. So in those cases, unlike the contracted foals, you want to try and keep bandages off of them.
And what do you typically see improvement in a few days, a couple weeks? Is it fairly quick?
You hope to see improvement daily with either contracture or laxity.
Okay. So post-foaling, what are some of those conformation issues that you really have to immediately do something about? I mean, are the ones you're talking about the ones you take immediate action on?
Yeah, so the ones that are very contracted, that are maybe walking on their toes or they're having trouble standing on their own, those are the ones that need to be addressed very quickly with bandaging or splinting or oxytetracycline. And like I said, the ones that are more lax, you can, depending on the severity, just kind of restrict their exercise, but those tend to improve with doing nothing, which is letting the foals get stronger.
Okay, well, maybe you can kind of talk about that a little bit. Restrictive exercise. How soon should any foal be turned out into an open pasture or a small turnout?
I mean, I would say it definitely depends on the problem. If you have a foal that has a little bit of contracture, then you don't want them to get too much exercise because they're painful. The contracted tendons will make them painful. And a lot of times you'll see foals that have been turned out and then they come in and their legs are shaking. Those ones, you want to restrict their exercise so that they're a point that doesn't happen, where their legs aren't shaking. But early exercise is very good because that is how, for normal foal, is very good to help normal musculoskeletal development.
Okay. So as the foal continues to grow, say it's a month or two old, what are some of the concerning issues that you see as a foal, gets beyond that neonatal and gets into maybe it's a month, 6 weeks old? What are some of those conformation issues that you see?
Yeah, so at that point, you're starting to look more at the fetlock. Does the fetlock turn in or out? And then also at the carpus or the knee, are they knock-kneed or are they, bow-legged? For the fetlock, some things that we can do to correct them are surgical correction, but also some conservative treatment, meaning you can have your farrier trim one side of the hoof or add extensions on one side of the hoof to try and kind of promote the correct growth. As far as the fetlock goes, there is a window of time that you have the opportunity to do some surgical correction. One being, if you want to accelerate growth on one side, that would be a periosteal transection or stripping, which we used to do quite frequently and don't do it as frequently now. But that procedure you would want to do kind of earlier in life, meaning 1 to 2 months when they're still at a rapid phase of growth. And then from 2 to 4 months is when we start looking at putting transphyseal screws on one side of the ankle. And so I would say if you're being very critical of the fetlock conformation, maybe starting at 2 months, you're really going to evaluate that. Maybe depending on the severity, you might look at that foal every couple weeks, have the farrier trim to try and correct it that way. And then if you reach a point at 3 months that it looks like they need more help than just trimming, then you've got to decide if you want to do surgical correction then.
Okay. So do you typically go out to the farms to evaluate these horses, or do they come into the clinic? How do you get involved?
Yeah, so it does depend on the farm, but I typically go out, and some of the other surgeons as well, go out on farm calls once a week, and a lot of times we're looking at the same foals that maybe the farm is a little bit concerned about them towing in or towing out, and you're trying to decide, when is it getting better, is it getting worse, when to intervene surgically. We also have some very good ambulatory veterinarians that are at the farms and evaluating those foals as well, and they might make the decision, hey, this one is not improving, it needs to come in for surgery.
Okay. So is there a window of time where it's probably too late, or you're not going to have quite the effect? I mean, is there a window where you've got to do this, or not at all?
Yeah, so for the fetlock, at 4 months, you've probably lost your window of opportunity, 4 to 5 months. So the ideal time to affect growth by putting a transphyseal screw in would be from that 2 to 4 months of age. For the knee or the carpus, you have a much longer period of time to affect growth, meaning up to yearling age. And a lot of most of the time, we're not manipulating the carpus until they're, say, 10 to 14 months of age.
Okay, I've got a couple more questions before we get to the video, and I just want to remind the audience, if you have a question, please use the Q&A feature. We do see somebody's tried to raise their hand to ask a question, but I don't know how well that works here with Microsoft Teams. So if you have a question, just put it in the Q&A and we'll certainly get to it. So are most of these corrective actions taken on the front legs, or is there things that take place, on the rear leg and the hock and the ankle, or is it typically in the front legs?
It's definitely more common in the front legs between the fetlock and the knee, but we'll see several a year that have the same conformation deformity in a hind leg. So there may be one hind fetlock that turns in that's severe enough that we put a transphyseal screw in it. But yes, it's much less common. For the hock, yeah, we don't often see problems with the hock, but we probably do a handful a year that are severe enough that need surgical correction in the hock.
Okay, so these corrective actions, is this strictly cosmetic, or does it actually help the horse in its future stay sound by changing a conformation defect, I'll say?
Yeah, so actually there was a study in the early 2000s that looked at, conformation abnormalities and how that affected racing and how that affected, risk for injury. And so, and they found a correlation. So offset knees or carpal varus, or where they're towed in, is going to put that horse at risk for problems or lameness in the fetlock region, in addition to the carpal region. Horses that are more turned out or have a little bit of valgus in their knees, they actually found somewhat of a protective effect. So we are as surgeons, we're much more critical if the foal is turning in or has offset knees, meaning we're going to encourage correction there, because that deformity is going to predispose them to injury.
Okay, very good. So I think we're going to start the video here in a second. So we're going to watch that, but before we watch the video, can you just talk a little bit about what conformation issues are being corrected on the foal and the subject on the video?
Yeah, so this, I think, is a 2 to 3 month old foal. that was evaluated at the farm by another veterinarian and then sent in because it toes in or has fetlock varus. And typically for fetlock varus in particular, if it's significant enough, that will only get worse, meaning as the foal ages and its chest widens, it will start to turn in more. So this foal has a mild fetlock varus, meaning it toes in, but it will get worse if not intervened, just because as the foal grows, that's typically how their conformation changes. So watching this foal walk, I'm just, standing in front of it, directly in front of the joint that I'm particularly looking at, so the knee or the fetlock, and then also watching it walk, because a lot of times the conformation abnormality will be more obvious at a walk versus just standing.
Okay. All right. So let's go ahead and get the video up, and we'll pause periodically so I can ask a question, or you might want to point something out. So we'll go ahead and get started with the video. So here it is. Okay, so this is the foal. Is this where you're just doing the exam?
Yeah, so I'm watching it walk towards me, and then I'll watch it stand. My technician will kind of square the foal up, and I'll stand directly in front of each leg. I will also watch it walk away from me to evaluate the hind end, meaning looking at the hocks and the hind fetlocks. And then just make some notes about the severity of the deformity. And, this one I would say is mild to moderate. I don't know if we have a good image of it from front to back. But also something to keep in mind is a lot of times the farms have been managing them with trimming. And so it might not be as obvious because they're kind of trying to correct it with trimming anyways.
Okay,
so that's where watching it walk is very helpful too.
Okay. So it looks like they're heading into the clinic, mom and baby, and they're going to get prepared here. So
so the foal and the mare and foal are going up to surgery. We have the mare sedated while we get the foal ready to anesthetize. So here we're in the induction stall. Our anesthetist is giving some sedation to the foal first.
Okay. So let's pause for just a second. So just for the audience to know, typically does the mare and foal come to the clinic together so that they're relaxed and you don't have the foal upset and the mare having a fit back at the farm?
Yes, correct. Yeah, they send both of them. We bring the mare and foal up to surgery together and then sedate the mare. And then once the foal is completely asleep, we take the mare back to a stall where she stays sedated until the foal is awake.
Okay. All right. Let's continue. Yeah, looks like mom's pretty relaxed there.
Yeah.
And it looks like the foal's about to lay down.
Mm-hmm.
Okay.
Yeah, so now the foal is asleep, and then our anesthetist will intubate it. So place a tube down the trachea, and that's how we keep the foal asleep while we're doing surgery.
Okay. And is this the anesthesiologist? I remember him from another panel we had, Dr.
Yes, that's Dr. Hubble.
Hubble, yes. Okay.
Yes, and he's been doing equine anesthesia for a long time, and he's fantastic.
Okay. I find this hoist process pretty amazing how you do that.
Yes, this is everyone who comes to visit's favorite part, to see how we get the horses on the table.
Okay.
So we'll just put the horse in dorsal recumbency, meaning just on his back. And then that way we can do surgery on both front legs pretty easily. And then the anesthetist will hook the foal up to a gas anesthesia machine. And then she will, put an IV catheter in, the foal will be on fluids. And then we also put in an intraarterial catheter to measure blood pressure. And that gives us the best accurate reading as far as monitoring goes for blood pressure.
Okay, can we pause for a second? So on this foal, it looks like you're going to do surgery on both ankles.
Yes. Yep.
Is that typical when you do this type of surgery?
It's probably 50-50. A lot of, 50% of them need just one, and then the other half need both. So,
Okay, very good. All right, continue. So you got everything draped and covered?
yep. So the foal has been sterilely prepped, and then they move
Mm-hmm.
into this surgery room. And so then myself and then an intern is scrubbed in with me, and we drape everything sterilely to get ready for surgery.
Okay. So what is this you're wrapping on? It looks like an iodine wrap or something.
Yeah, it's called IOBAN, and it's just a kind of sterile adhesive. So that
Mm-hmm.
basically the only place that's kind of open is where we make our incision.
Very good. Okay. Okay. So what's happening here?
Okay, so they are taking and this might be a little bit out of order. This actually, usually we take
Like,
these radiographs after the screw is placed.
okay, so that might have been out of order, right? So what's
But now,
happening here?
so now what we're doing is we're placing a needle in the growth plate. So the growth plate is, a lot softer than the surrounding bone.
Mhm.
Um, and so just to mark where the growth plate is, because we want to put our screw across the physis, the needle just helps me determine where to make the incision, to figure out exactly where to place the screw.
Okay. And in this incision, how big of an incision is it? Doesn't look very large.
Yeah, it's just about a centimeter. And so
Okay.
the incision is made about a centimeter above or proximal to where that needle is. And so I make that with a scalpel blade, and then I kind of just dissect the soft tissues with that hemostat before drilling. So this is where we're drilling for the screw.
Okay. And doesn't seem like there's much blood in the process.
No, yeah, it's mostly a bloodless process.
Okay.
And so when I'm drilling, I just drill enough that I'm completely across the physis, but away from the joint itself.
Okay. Can we pause a second? So is that the actual screw that's going in, or is this
No,
a
I think
guide?
this is so that is the drill bit, so that makes the hole for the screw, and then there's a soft tissue protector that's over the drill there, just so your soft tissues don't get caught up in the drill bit.
Okay. All right. Continue. Yeah. Yeah, we've kind of muted the sound. That spinning and almost sounds like the dentist drilling your teeth.
Yeah.
Um,
Yes. And so
all right.
now what I'm doing is tapping the hole. So basically making the threads for the screw.
Okay, very good. Was that the actual screw there?
Yeah, the next thing is the actual screw that we'll place.
Okay,
And I will put that mostly in with the drill, and then use the hand driver or screwdriver to tighten the screw fully.
okay, okay.
Um,
I can see the head sticking out still.
Yeah, yeah. So, and when we tighten the screws, because obviously these screws have to come out, I usually take time to kind of back it out just a hair, so that whoever's taking them out, typically our ambulatory vets take them out on the farm, and we do it standing, that it's easier for them to get out.
Okay, let's pause for a second. So that's a point I wanted to ask about.
Mhm.
So the screw goes in, it's recessed, so you're going to suture it up here in a moment, I think.
Mhm.
How long does that stay in? I mean, I was going to ask you, do they come out, or how long do they stay in? It sounds like they do come out.
Yeah, you typically they're in about 4 weeks. Sometimes depending on the age of the foal, because if it's younger, you're gonna have probably correction faster. If it's older, it's gonna take a little longer to correct.
Okay.
And then also the severity. And a lot of times, if you're doing both, you may have one leg that is a little more crooked than the other.
Mm-hmm.
And so you may end up taking one screw out earlier than the other. So maybe, at 3 weeks, one of the legs is very straight. So we take the screw out in the left front. but the right front's not completely where we want it. So you may wait another week or two to remove that one. But like I said,
Okay.
typically they're removed at the farm standing just with sedation. So it's not a big deal to do that.
Okay, all right, that's good to know, because I was thinking they would have to come back to the clinic. All right.
Yep.
Okay.
And so now I've just gone to the other side and we'll do the same thing here.
Okay, very good. So same process,
Mm-hmm.
same length of the screw. Do you use different sizes for different horses, or all one size fits all?
Pretty much one size fits all in this case. You know, you don't need a really long screw. You just need enough to go across the physis on that one side to stop growth there.
Okay, so let's pause for a second. Maybe you can elaborate on that. We're trying to stop the growth in a certain way. Can you maybe explain that a little bit deeper?
Yeah, so for this particular horse and the most frequent problem that we see in this age of foal is that they're fetlock varus, or they're toed in. So what that means is they're growing faster on the outside part of the physis or growth plate than they are on the inside. So when you place a screw across the growth plate or physis on the outside, that halts the growth there. And then that allows the inside part of the growth plate to catch up. And so that's how the screw works.
Okay. And how long has a surgery like this been common? Has it been in the last 20 years, 30 years, 5 years? I mean,
It's,
what?
I would say at least the last 30 years. Yeah.
Okay. All right. So 30 years prior, you had what you had.
Yeah, exactly.
Okay. All right. Let's continue with the video.
So yeah, again, I'm just drilling the hole for the screw there, have the needle in the physis or the growth plate, so I know kind of where the screw is going to go.
Mm-hmm. Good.
And so now I'm going to tap the hole, meaning I'm just making the threads for the screw.
Okay. So any residual issues after this is done and the screws are poured? I mean, do the holes just close up on their own? I mean,
Yeah.
I
Yes,
mean,
basically. Now, sometimes I will say in older horses, you may see a little bit of a lip or reaction above the growth plate there, and that's probably from the horse having a transphyseal screw at some point. But most of the time, you never see any remnants of them having had a transphyseal screw.
okay. All right. So you're doing the last part by hand.
Mm-hmm.
And when that's done, can you actually take your hand and feel the screw, or is it?
Yeah, you can feel a little bit of the head of the screw if you really kind of press down. So
Okay,
now we're
hold on,
ready.
let's stop for just a second. Maybe go back a little bit, Shannon. So we've got both ankles done, and so what takes place next?
Yeah, so now we're going to take some radiographs or x-rays and make sure that our screw is exactly where we want it across the growth plate.
Okay, very good.
And I think they'll show a close-up of the x-ray.
Okay.
Yeah, so there the screw is just through the lateral outside part of the growth plate or physis and above the joint there.
Okay, very good. And you'll have that done on both legs just to examine that. Very good.
Correct.
Okay. All right. Looks like a screw right out of my toolbox.
Yeah.
All right, so what takes place here?
Yeah, and so then we'll just close the skin with some suture and then bandage. And then typically the farm veterinarian will remove those sutures after 12 to 14 days.
Okay, so while you're doing this, question, how long did this, I mean, we've kind of cut out a lot. So from start to finish, from the time that you arrive and start the procedure, how long does this generally take?
From the time that I, come in the room and drape and close, it's probably 10 minutes. It's not very long procedure at all.
Oh, okay, very good. So would you do multiples of these in one day, or is it you one and done and you're back out in the field?
No, typically, and all the surgeons at Root and Riddle kind of have surgery days, and then
Okay.
outpatient days and farm call days. So you may do as many as 10 of these transphyseal screws in a day.
Oh, okay, very good. All right. So next then. Right.
Yes, yeah, on to the next.
Okay, so the foal, we didn't see the foal recover and go back to the stall. So talk about that. I mean, how's the recovery? How much stall rest? How much turnout for this foal after it goes home?
Yeah, so the foal, first of all, when you're done and the legs are bandaged, it goes into a padded recovery stall. And we have some some guys that that's all they do is recover horses and foals. And so we have one guy that will sit with the foal and wait till it's extubated, meaning take the endotracheal tube out, and then he'll help them get up. And then they take that foal once it's kind of stable enough and able to walk back to the mare. They'll walk the foal back to the mare. Probably give the foal another hour or so to get fully awake before the farm comes and gets them. And typically these foals go home the same day. For as far as stall rest goes, they'll be on stall rest just a few days, and can be turned out even with their bandages on. Kind of the biggest problem with these post-op is making sure that the incisions stay clean, the bandages stay dry. So depending on the weather, we try and encourage people to just make sure, they can get turned out, but just make sure those bandages stay clean because there is a risk of infection. But after 2 weeks, once the incisions are healed, then they're often, back to their routine turnout. And
when they're come out of recovery and walk around the stall with the mare, are they sound or are they a little ouchy on it?
If they're ouchy, then we're worried that something went wrong.
Okay, all right.
So typically they're very sound. They don't know what happened to them.
Okay. I have another question. So besides surgery, are there other procedures that can be done to help on that conformation? I mean, is there from a blacksmith or from a trimming or from putting extenders on or other things that can be done short of surgery? Yeah, so trimming or extensions will definitely help, and you would, start those. And like I said, most of the foals that we see that's already been done, meaning they've been monitoring that foal at the farm and they've been trimming it or maybe putting a little bit of Equilox extension on one side to try and get the foal to correct on its own. But then as you kind of continue to monitor it, and if the foal's not correcting fast enough with that, then that's when we resort to surgery. Okay. So Keeneland just wrapped up the November mix sale, a lot of weanlings in that sale. If a foal has this type of surgery, does it show up in the repository? Does it have to be declared? I mean, what are the procedures when somebody has a commercial foal that they want to sell that has had procedures like this done? Yeah, so for transphyseal screws, they do not have to declare them. So you would not see that in the repository. Things like arthroscopy for OCD removal or an airway surgery, those things have to be declared. But for angular limb deformities, such as a transphyseal screw, that doesn't have to be declared. Okay. And do you have any kind of a guesstimate how many sale foals have this done? Is it pretty rare? Is it pretty common? I'd say it's fairly common, but maybe 5% of them. Okay. All right. So not a huge percentage. Not a huge percentage, no. Okay. So that's all the questions I have. Audience, if you have questions for Dr. Broyle, we're going to pause for just a minute, and I'm going to look through questions that are already there. And if you have one, please submit it. And we're going to be back in a second after we hear from our sponsor, West Point Thoroughbred. So just stay tuned. Okay, thanks, West Point Thoroughbred. So a few questions in the queue. So first one is, what is the success rate for this type of corrective surgery?
Okay, so as long as you perform it in the window of time that we talked about, so for fetlock specifically, for that 2 to 4 month period, then it has a very good success rate. The only time you have one that's not going to correct is if you wait too late.
Okay.
The biggest complications are like I mentioned earlier, infection. So infection, either just the incision or the skin, or you can get the screw to get infected as well. And that's where the post-op management with bandaging and keeping the incisions clean is really important.
Okay. I guess I'll follow that up with, you ever have to go back in a second time?
No, I have not had to go back in a second time. I mean, there's been cases where the screw got infected and you needed to take it out sooner than you wanted to, because of you don't want the bone to get infected.
Right.
But as far as repeating the procedure, no.
Okay. Here's a question: are the screws removed? I think we covered that. So it just sounds like the screws are removed right there at the farm.
Yep.
Okay. So when I guess I'm wondering, when that screw is removed, do they have to do a slight incision to get to the head of the screw?
Yeah. So typically when we remove the screws, we put some local anesthesia kind of above where the screw head is. And a lot of times you can kind of palpate and get an idea of where the screw is on the leg. Mm-hmm. And then we'll take a needle and feel for the screw with that needle. And it's pretty distinct, what metal feels like against the needle versus bone. And so then based on where the screw is from that needle placement, just make a small stab incision, a smaller incision than we made to place the screw.
Okay, very good. Here's a good question. What's your approximate cost for doing a surgery like this?
Yeah, so I think here it is about $1,500 to $1,800, something like that, I believe.
Okay. So is that all inclusive of the stay that they're there and the surgery?
Yeah, I think typically you charge it as a package deal. So
okay, and that would be both sides, or $1,800 per side?
No, that would be kind of the whole thing. It might be 18 to 2 for two sides, but that it doesn't increase the cost very much to do one versus two.
Okay. Next question: are most corrective surgeries performed on the ankles, and are there any corrective measures that you do for knees?
Yeah, we do. I would say many of them, or the majority, seem to be in foals, but we do a very in the fetlock and foals. But we do a significant amount in the knee or the carpus. In the carpus or the knee, that growth plate is going to be amenable to surgical correction much longer. So typically we don't do minor corrections to the knee until they're 10 months to 16 months of age. The only time that we would do corrective surgeries for knees in foals is if the deformity is severe enough that they're having trouble walking, or it's creating a secondary problem.
Okay.
But if they're just minor deformities, then we'll wait till they're much older, because one, they may correct on their own with time, and two, you really don't want to manipulate the growth plate and cause a fasciitis during the rapid phase of growth, so meaning 0 to 6 months of age.
So is a good gauge ankles 2 to 4 months, knees 10 to 12?
Yeah, 10 to 14 even
Okay.
14 months of age, you can correct a knee.
Okay, very good. So, well, that's all the questions we have. So we're done just a little bit earlier. So I just really like to thank you, Dr. Broyles, for your time. The video was very interesting. It's always amazing to watch these things. I learn something every time we do these. So I appreciate your time and the video and your insights today.
Yeah, thanks so much for having me.
Also like to thank our panel sponsors today, Juddmonte Farm and Rood and Riddle. But mostly really like to thank our audience and the owners for investing in our sport, because we have many stakeholders in the industry, but I've always believed that owners are the most important and needed participants. So thank you very much, owners. So as I mentioned earlier, we're going to be back in December with our final webinar for this year. Plus, just to let you know, we've got 10 more planned for next year. So until next month, stay safe. We hope you visit the Winner's Circle and you visit it often. Thanks, everyone. Thanks, Dr. Broyles, and we'll see you next time.
Thank you.